will be celebrated or observed all over the world to place the demands for cancer patients, to remind the government that the cancer patients have a right to get proper treatment and proper access to equitable treatment. That is the word they use, equitable treatment. All patients should get equitable treatment. So for that observation, every year on World Cancer Day, the WHO and the International Union Against Cancer, they choose a theme for observing the World Cancer Day. So the last 3 years theme was close the care gap. That means a lot of patients don't get the care because of financial problems, because of accessibility problems, because of familial problems and all these things. So close that somebody, two persons having the same cancer, one is getting a very good treatment and one is getting almost no treatment. So that gap should be closed. So last year was that, last 3 was that. This year, 25, 26 and 27, these 3 years will be united. We are united by our fight, but unique in our story. But fight for cancer treatment and cancer related problems is for everybody. We are all united in that fight. But everyone has got a unique story to tell. Everybody's problem is not same. A male bed earner has got a different story. An old female patient retired in the house, she has a different story. Nobody to look after her. Like that, everybody has got different story to tell regarding cancer. But we are all united in our fight. So this year theme is united by unique. Right. Now regarding this particular press conference that Apollo has organized and taken initiative, for which I am very thankful to them as a Secretary of the Indian Cancer Society, and though I am a consultant here also as article of. So the thing is this, that if cancer is made notifiable, then a lot of things will follow that. Because to make it notifiable, government will have to make it a proper infrastructure, that how the cancer will be notified. And to follow that act, that data verification, and regarding according to the incidence, we'll get a proper incidence report. According to incidence, the prioritization of policies, building up of infrastructure, scaling up of training programs, all this will follow, and funds, regarding funds. So let me tell you a little bit of background. In 2022 September, the Parliamentary Joint Action Committee on Health, they had an elaborate meeting on cancer, where all stakeholders were present. Even Apollo Hospital was present, Apollo Hospital presented their view, and the Indian Cancer Society presented their view, Tata Memorial Hospital presented their view, different departments of government presented their view. So the decision there was that cancer should be made a notifiable disease, because only how do we keep track of the cancer patients? We keep track of the cancer patients through cancer registries. Every big hospital and every big city have cancer registries where cancer patients are documented. But in India, we have 34 population-based cancer registries and about 260 or 270 cancer hospital-based cancer registries. That covers only 10% of the Indian population. So 90% of population are not reported there. So that is, if cancer is made notifiable, all will become under the purview of those registries. So that is very important. So government will know what is the real problem, and accordingly then demands can be placed to government that you allocate this amount of fund, you develop this infrastructure and all these things. So that joint committee made this recommendation to Department of Health. But Ministry of Health, they did not agree. It was they sent it in 2022 September. Next year, the Ministry of Health said, no, we are not going to make it a notifiable disease because it is not a communicable disease like smallpox or leprosy or TB or something like that. It's not a communicable disease. So we are not going to make it a notifiable disease. So the things resting, at present resting there. The Department, the Joint Action Committee on Parliament, they have withdrawn their recommendations, is the objection of this placed by the Department of Health. So Tata Memorial has come up with a solution to that problem, that if you don't make it notifiable, at least make it documentable. So I don't know by that, but I presume, what we presume that they mean that if you make it notifiable, then somebody has to be responsible to make it to notify that. And if somebody does not notify that, and if a law is passed to notify that, then that somebody must be punished for that. So that is one point why government is hesitating to make the whom to punish, how to punish. So that's the Tata Memorial has come up with a middle way. If you make it documentable, so if you fail to document, you will not be punished. But if you make it documentable, then automatically, gradually, all patients will come under the registry, like Aadhaar card. Like a lot of places we go where Aadhaar card is not required, but people always ask for it, and we give. If we don't give, they don't give the service, like that. So it is, the Tata Memorial has said that it should be documentable. Government has, to some extent, I think they have like that idea, but whether they are going to implement it or not, we don't know as yet. So the present situation is that the recommendation has gone to government to make it notifiable. Apollo is one of the prime mover of that recommendation. So they took recommendation from everybody. So Apollo has made a very good recommendation there. They suggested to make a centralized laboratories to document cancer cases. All centralized laboratories or centralized database of those laboratories and radiation laboratories, then automatically lot of data will come there. So that recommendation government has accepted. So when they will implement it, I don't know, but theoretically they have accepted.